the semaglutide was approved for the treatment of obesity, there was a really significant uptake in the desire for treatment, particularly with highly available pharmacotherapy for treatment. And with this, we wanted to look at how would this affect individuals throughout the United States? Who was available to treat these patients? Were they trained to provide therapy and care? Hello, my name is Dr. Fatima Cody Stanford. I'm an associate professor of medicine and pediatrics at Harvard Medical School, and I'd love to introduce our article entitled Shortage of Obesity Medicine Specialists in the United States, which will be appearing in the February 2026 Mayo Clinic Proceedings. This is a really germane article for myself as one of the first fellowship-trained obesity medicine physician scientists, and I really want to delve into this article as we talk about obesity, the most prevalent chronic disease in human history, and we're going to talk about its prevalence here in the United States, affecting over 100 million Americans, and it costs over $1.7 trillion. Now let's talk about this, particularly as we talk about the number of specialists that are actually certified to treat this disease here in the United States. Now we're going to be talking about data based upon that information that is available as of December of 2024. We do want to recognize that this may have been updated based upon the most recent certified American Board of Obesity Medicine specialists, and we want to delve into what's available and how does this affect the treatment options available to those throughout the United States. What we have seen based upon previous published data, much of which I have worked on, is that individuals that are actually certified in obesity medicine are able to provide evidence-based therapy for individuals with the disease of obesity. So in this particular article, we looked at the 9,895 board-certified obesity medicine specialists as of December 30th, 2024. And we sought to identify those individuals. And this was based upon the American Board of Obesity Medicine available data. We also looked at the Obesity Medicine Fellowship Council data. So we wanted to determine those that were fellowship trained and those that were certified. And these are two different groups. When we looked at the fellowship trained group, we recognized that this was a much smaller cohort of individuals, just a little over 120 individuals. There are only a few of us that have completed a really in-depth amount of fellowship training, meaning 3 or more years of fellowship training, less than 10 of us in the entire United States. To be able to handle really complex chronic disease, pretty much like things like Prader-Willi or melanocortin-4 receptor mutation. And so there's some distinctions that should be noted for those of us that can handle those complex chronic diseases associated with really complex issues surrounding obesity. When we put these together, we also looked at the 2024 County Health Rankings and Roadmap data set to look at what this looked like as we looked at the distribution of these individuals across the United States. So in 2024, there were 9,423 board-certified obesity medicine physicians in the United States, with half, that's a little over 4,700, that were board certified between the years of 2022 and 2024. So just recognize that uptake in individuals that decided to seek certification. Most of these came from primary care backgrounds, so that's really important information. And only 129 of those were actually fellowship trained, so those that received actual fellowship training within the field. But I want to recognize that only more than half of these, 52%, were practicing in only 5 states. What are these 5 states? New York, Pennsylvania, Massachusetts, California, and Ohio. So a large majority of these are based in only 5 states. Recognize we have 45 additional states where these individuals could practice, and we're going to talk about these issues. In total, 44% of states had no fellowship-trained obesity specialists. So that's really important for us to note. Also, it's important to us to note that when we look at this and we talk about fellowship training and we talk about those, we have to look at what this really means for looking at individuals that have a high predisposition for obesity. We are looking at levels of unemployment, those that have rural backgrounds, and we recognize that those that are rural backgrounds and high level of unemployment may be more likely not to have someone that either has fellowship training or board certification in their state to care for them. This is unfortunate because those are individuals that have a higher predisposition for obesity. And I think I want to point out something that's very important. In a multivariable logistic regression for American Indian Alaska Natives, Asian Americans, Black Americans, high school graduates, health professional shortage area, median household income, rurality, and lack of insurance, there's a 1 percentage point increase in county level obesity that was associated with a 0.7 percentage point increase in the probability that a county had no board certified obesity medicine physician. This is really, really important. So let's think about some take-home points as we think about what we can be thinking about as we think about this rise in obesity that has happened, particularly over the last 20 to 30 years, and thinking about as we see an increase in individuals that are seeking the certification and those that are seeking fellowship training, what can be done? First of all, we know that most people are getting less than 10 hours of training in medical school for obesity at all, and that's in all medical schools, whether public or private. We know that we're going to need to start using more telemedicine and telehealth to care for individuals, particularly as we recognize that people that are in rural areas, those that are in low-income areas that may have higher predisposition for obesity aren't receiving care that they need. And we have to recognize that obesity is a disease that affects everyone, regardless of socioeconomic position, racial, ethnic background, and we need to make sure that the individuals that are caring for patients, which are all physicians and other advanced practice providers, are trained to provide care for these patients. We're happy that the American Board of Obesity Medicine and the Obesity Medicine Fellowship Council are focusing on increasing the number of physicians that are focused on this particular disease process, but we're going to need more. We've already talked about over 100 million individuals with this disease process, but more is going to need to be done. We also are going to need to have better reimbursement to make sure that those individuals in these areas that face worse access are able to receive the access that they need and receive equitable care for the treatment of obesity. It's been a delight to be here with you today, and I hope that you go spend time looking through this article and think about how you can be part of the solution in providing equitable care to patients with obesity.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.